Dr Thiru, what would you say is the difference between GP skin advice and advice from a specialist dermatologist?
A GP is a doctor who has trained in general medical advice. However, their skin advice are limited. However, a specialist dermatologist has been trained in this specialty for years. They can give you the right advice and manage your skin appropriately with the right diagnosis and treatment plan.
For cosmetic concerns like skin tags and moles, how does one decide if removal is the most appropriate way to proceed?
Obviously, one should be assessed by a specialist dermatologist whether the skin tags or moles that need to be removed, and they can diagnose with whether they are completely harmless, and they can remove it if needed, especially if it is catching you or causing you bother cosmetically. This can be safely assessed and treated by a specialist dermatologist with various procedures, including a shave or laser removal, causing less side effects and less scarring. This is more reassuring from a dermatology.
Doctor, what does one need to know about mole removal and any potential post-surgical complications?
Moles normally removed for two reasons. One, where patients don't like it or it's causing some symptoms like catching, so they want to get removed. The other option is when the patient having problems like changing moles, where medically it need to be removed and get tested under the laboratory, what we call biopsy testing. This is done surgically. Either we cut out or shave and stop the bleeding with immediate dressing, and then the sample is sent to the laboratory for testing, and this can be assessed safely with certain tools which we have, what we call dermoscopy. Although the scarring can be more obvious initially, this can settle in few weeks time, which will leave you no residual mark.
Dr Thiru, what acne treatments are available, and can I get Roaccutane treatment in your clinic?
The answer is yes. We provide all the acne treatment in our clinic, including topical treatment, antibiotics, and Roaccutane, which is a magic pill for acne, which is exclusively given in my clinic, and I have helped thousands of patients in the last 10 years, where they are so happy after the 6 months of treatment. However, people who need isotretinoin, other words is called Roaccutane, needs special blood test before we give it to them to clear their acne.
Doctor, do you assess hair loss in your clinic, and what are the treatment options?
Absolutely yes. Hair loss can be a distressing problem to my patients, and I can certainly help these patients with a lot of treatments that includes topical lotions, tablets, or injecting their own plasma into their scalp, which promotes hair growth, which is called what we call PRP treatment. Certainly, hair loss can be treated, especially if it's treated by the right person, and this can be assessed appropriately with the dermoscopy I have, and we can diagnose properly and treat you with the right treatment options as you need. If you have any questions you may have, please leave them down below. I'm more than happy to answer your questions. Thank you for watching.